Nadi Pariksha is a skill, right? It is not a technique or it is not a science. It is always better to be dependent on the rational things. Wherever you go, it has to be the same. There has to be the standardization in the diagnosis, and the standardization is about the Darshana, Sparshana and Prashna.
Taking Ayurvedic medications is only the way of treatment in Ayurveda, or any other factors are also included?
Ayurveda believes in that. Ayurveda try to strengthen your mindset, and for that it has given simple techniques. See, the products which are available in the market in the name of Ayurveda, most of them are not Ayurvedic products. They are herbal products authenticated by the government of India. Then that researched product or a medicine can be called as Ayurveda.
We think that Nadi Pariksha is only the method of diagnosis in Ayurveda. Nowadays, the Nadi Pariksha is very famous, and whenever the people think about Ayurveda, the first thought they will get that Nadi Pariksha. Is it true that only the Nadi Pariksha is the method of diagnosis in Ayurveda, or what you say, sir, about that?
A perception about Ayurveda is still very different in the society. People still don't think that Ayurveda is a science. In many of the times it is noted that people look at Ayurveda as something kind of magic remedy or a magic treatment. It is not that. Whenever you feel that there is a chamatkar or magical thing happening, people get more attracted. When I see a nadi and then I see that, you had a paneer yesterday and that is why you are suffering from this. If I say, the patient gets amazed after listening that, how come you know that I had the paneer yesterday? So that all that is very much possible, but that is not the only way of diagnosis. Nadi has not been mentioned, Nadi Pariksha has not been mentioned in the original classics of Ayurveda, that is in Charak, Sashruta and Bhagavad did not mention. It has been elaborated as a skill by the later acharyas in Ayurveda, and it has been mentioned in Yoga Ratnakar, like later granthas. So again, Nadi Pariksha is a skill, right? It is not a technique or it is not a science. Every doctor has to develop that skill. Some people want a patient on empty stomach to get a clear nadi. Some doctors don't need that. So they can assess the nadi at any given time. So all that is a skill, and that depends on person to person. So that is not a rational thing. So it is always better to be dependent on the rational things. Wherever you go, it has to be the same. There has to be the standardization in the diagnosis, and the standardization is about the Darshana, Sparshana and Prashna is the classical method of diagnosis in Ayurveda. So but if somebody is doing Nadi Pariksha, there is nothing wrong in that, but that is not the only thing.
Taking Ayurvedic medications is only the way of treatment in Ayurveda, or any other factors are also included? Nowadays the marketing is happening like by taking the taglines like Ayurvedic products, like Ayurvedic shampoo, Ayurvedic soap, cosmetics products also, the marketing is happening. Is that true that Ayurveda is extended till there itself, or some any more about Ayurveda is there to know?
Yeah, over the ages, Ayurveda has been marketed or presented as a product. Ayurveda means Chawanprash, Ayurveda means shampoo, or Ayurveda means soap. It has been always projected like that. But product is one part of entire Ayurvedic system. For anything, you always need a product, right? So it's a medicinal product, it's a cosmetic product. Everywhere you need a product, but that is not the thing. In the Ayurvedic treatment modalities, when we treat a disease, there are mainly 4 or 5 things included. First thing is about the detoxification, how we should detox our body. That has a very prime importance in Ayurveda, like which is called as Panchkarma in Ayurveda, like Vaman, Virechan, Basti, Nasya and Raktamokshan, right? Second is about the diet management. What should be the right diet and what should not be. Third is about the lifestyle. how you should follow your circadian rhythm and biological clock. That is the third important thing. Fourth is about your exercise and what kind of yoga you do and how you keep yourself physically fit. Fifth is about mental well-being, how you meditate, how you keep yourself mentally fit and strong and courageous. See, the courage is one thing which cannot be borrowed from anyone, right? So that has to come from inside. So Ayurveda believes in that. Ayurveda try to strengthen your mindset, and for that it has given simple techniques like get up early in the morning, right? Do mantra chanting, do meditation, and the methods of meditation are different. Like somebody might get meditative position while worshipping a god, right? Somebody might get it while chanting some mantra. Somebody might meditate just by sitting like this, right? So there are methods, and all these methods which are incorporated in our lifestyle of meditation are completely meant for our mental well-being and to increase our strength of the mind. Because see, it is very easy that to find a physically tough situation. For example, if I ask you to run for 10 kilometers continuously, right, and which you are not used to, so it will be a tough for you. But over a period of time, by practicing that, it will be possible for you. So I am putting you in a tough physical state, and that you develop that. That is one part, right? But how would you put yourself in a tough mental situation or a psychological condition, right? So that is very important. Generally this doesn't happen. So we doesn't put ourselves in a challenging psychological or a mental condition, and we don't practice how to face to that. Once we are able to face or practice to face such tough situations, so then we would be always ready to face situations in life. So that doesn't happen. This is how Ayurveda teaches you how to do that. So as you asked, whether Ayurveda is restricted just to a product, never. See, the products which are available in the market in the name of Ayurveda, most of them are not Ayurvedic products. They are herbal products. One can call any product as an Ayurvedic product only when there is a reference in the classical text, right? Or even if there is no classical text, but you have researched that, you have submitted your research to the authorities of Ayush department, and once that is authenticated by the government of India, then that researched product or a medicine can be called as Ayurveda. So when we talk about the medicines which has to be consumed on regular basis, consuming amla juice or aloe vera juice, which itself is having some preservative, is also not a very authentic practice, because Ayurveda has given certain set of medicines which can be consumed on regular basis. Very famous example is Chyawanprash. But again, there is a big list of such medicines like Amlak Rasayan, Brahma Rasayan, Agastya Rasayan. Out of that, which particular medicine has to be consumed by you or a particular person, again depends on a particular parameters, like where do you live, what is the weather conditions around you, what is the occupation. As I mentioned earlier, those parameters has to be applied to that, and then only which medicine has to be consumed on the regular basis for the immunity boosting and immunity building is decided in Ayurveda. So yes, this is how product has to be always looked at in Ayurveda.
You all liked today's video, and I am sure that you got benefited from today's discussion on the topic Ayurveda. And if you want to have more information, you can go to the website tapasyahealth.com, which have been mentioned in the description below, and you can also contact to the office number mentioned below. For more such interesting information, please subscribe to our channel. Thank you.